Tell me and I forget. Teach me and I remember. Involve me, that's when I learn. This is a quote from Benjamin Franklin, and I find this to be very true. How about you? If you remember back when you were a student in the PT or PTA program, and I'm sure through one of your clinicals you at least found a great CI. And if you think back, they probably involved you and they taught you many things and you learned from them that you maybe still use to this day. That's the goal with this video here. That's the underlying purpose, is making sure that we understand the students' rights, your responsibilities, and the different learning styles to set up a positive learning environment for the students. Hello, welcome to the site. Hello, welcome to the CI information video. My name is Autumn Hoffman, and I am the Colby Community College PTA Program Director. This video is going to talk about three different things: student responsibility, CI responsibility, and learning style. The video will be about 12 to 15 minutes long, so feel free to kind of scroll ahead to wherever you want to learn more information about. So starting off with our student responsibilities, the overall purpose here for the students is to make sure that they meet the requirements to pass the clinical and to pass the program. They have that main responsibility to get all of those check boxes checked off. The CI responsibility is to help us, to help Kit and I bridge this gap between the classroom and the clinic, allowing students to have those hands-on opportunities in a safe and positive learning environment, with the CI mentoring them right next to them. And lastly, here we're going to talk about learning styles. We all have different learning styles, which sometimes leads to different communication styles or personality and things. So I think if we understand their learning style, we can help increase our communication and create a more positive communication back and forth between one another that makes it a very easy clinical, really, when we have that communication and they're asking those questions and they're really learning. And it almost lights up the CIs, or at least it did when I was a CI. So we'll dive in kind of a little bit more in depth. With our student responsibilities and rights, the students need to be in professional dress with the name tag, and they need to be on time. That's something they can control. You don't control that. If they're breaking those responsibilities, please make me aware. Also, they need to practice professional judgment and ask for assistance when necessary. Again, communication is key. I don't want them to be overly confident that they don't ask you questions and we have a safety concern on our hands. I want you to be there next to them, making sure that they feel comfortable asking you questions and have that open communication. But overall, that's still their responsibility. They have been taught over and over again throughout the semester to be proactive learners, that they need to seek learning opportunities. You do not have to bend over backwards and provide opportunities for them. They can ask what articles they need to read. What techniques can they practice at home? Can they practice techniques on you so they feel more comfortable practicing on the patient? It's their job. You don't have to take on that responsibility. They need to learn to be owners of their education. This is kind of a conjunction of both the student and the CI. Responsibilities is minimum of 40 hours per week, but no more than 50. On a short 3-week clinical in December, there's really no need for them to take any personal days. So, they need to make sure that they have that all taken care of. If something does happen, we do have a policy of how days are made up, which I will explain here momentarily. Lastly, the students are responsible for completion of the ESP. That's the grading tool. They will make sure that their student section is all taken care of, and they will ask to look over your CI section to make sure all the I's are dotted and the T's are crossed before they leave. So make sure you establish some time before you leave on their clinical rotation. As clinical instructors, you have responsibilities and rights as well. First off, number one, please be a licensed PT or PTA. If you have let your license lapse or anything, please call me right away or talk to your CCCE at your facility. Number two, I think, is one of the hardest ones to do. I know it's hard to give up your patients to a student. You have built that trust, that respect, and developed all these techniques and stuff to help make your patient load gain their functional potential and meet that. And now I'm asking you to share it. Please understand that we respect that, and the students are being taught to respect that as well. So we understand if there's a couple patients you don't want to release to a student, that's okay. But all I ask is that you begin to let students be hands-on and be a part of your patient load so they can learn how to time management and solve problems as patients. We all know are not textbook patients. Okay? There's always problems that arise throughout the day, either with patients' communication scheduling or just in the facility in general. So make sure that you're kind of help guiding them in that. Establish regular meetings to go over the ESP. Set your weekly goals. Make sure that they know your expectations, what patient interventions we're working on that week, so they can start checking off the boxes, so they can start adding skills underneath their belt there. Communication is vital. Again, I know a lot of times it's almost muscle memory for me when I'm working on a patient. I can palpate here, or I can place modalities, and I just kind of go through the motions. And I know what I'm doing because, I'm thinking it through my head. But this is the time where you explain the whys. Why are you choosing this parameter for this modality? Why are you choosing this exercise? Why is you choosing to do this soft tissue massage technique? Explaining those whys. You probably hated those whys questions in school. But this is where you get to talk it out to the student and they get to connect those dots. And again, make sure you establish expectations and the student follow-throughs. So if you have these certain 4 expectations that you expect for all students that walk through your facility, make sure they're aware of it. Not all students can read in between the lines or can observe your expectations. So please make sure that it's very point blank and it sets the student up for a successful follow-through. And I think all of this kind of creates a positive learning environment. Now, I do understand clinics do have some drama and stuff, so please don't pull students into the clinic drama. I know there's going to be drama no matter what clinic they work at, or a hospital, or if it's even outside of the PT world. We know there's always drama. Just please don't drag the student into that. Don't make them take sides. Don't air out your dirty laundry to them. We want to make sure this remains a positive and effective learning environment. Lastly, the last 2 here is kind of your rights to evaluate our educational program. Let us know what you need, if there's anything we can work on, what techniques you want us to teach the students, anything that we can do to help make your life easier as a CI. Now that said, that's within reason as well. We know that some of you have been to tons of continuing education courses. And just remember that we can't always teach all of those continuing education courses. We can introduce them to it, but that's where you come in and help growing their learning for those different things and wanting to be a lifetime learner and always growing in this field. Lastly here, you have the right to dismiss the student. This could be for any professionalism reason, any safety concerns, or whether you've had a major safety issue, or any other issues that may arise that you feel the need to dismiss the student. All I ask, and your number one responsibility in this regard, is to make sure that you call me first before you just have the student walk out of the building. Let me get involved, and we can go through that dismissal process. Overall, what do we do when there's conflict? Not all the time can we prevent conflict. There's issues do come up. Number one, make sure you establish what the problem is and communicate how you should solve it together. Make sure the student is aware. Please don't do this in private or yell at them in front of patients or other coworkers. Make sure it's in private and you have a clear problem and kind of some solutions that you both can agree to. If that doesn't quite work out, go ahead and give me a call and we'll see if we can work things out together to resolve the issue. If all else goes awry, please give me a call and then we can talk about dismissing the student and we'll go through that dismissal procedure in that phone call. Some of the most common issues or common emails or phone calls I get are hours. Again, it's 40 hours per week. If they miss a day, it's a 1-to-1 makeup. Now, if they are on a disciplinary action contract, then it may become a 2-to-1 or a 3-to-1 ratio. So if they miss one day, they may need to make up 2 days or 3 days for that one day missed. That's not your responsibility to volunteer your time for that. We can either make that up at another clinical or they can make it up after the program and make it up in the middle of August. So you don't have to be concerned about that. That is the student's responsibility. Special projects, in their December clinical, they're not required to do a presentation or a project, but if you see it as a good learning opportunity and you want to learn something more for your department, have them do a presentation or a project. That's totally fine with me and it's a great opportunity for them. All right, our last thing here is we're going to jump into learning styles a little bit, and I know some of you are very aware of this, but I just wanted to give you kind of a little ins and outs of the class this year. We have visual learners, kinesthetic learners, auditory learners. Most of my students fall into the visual kinesthetic learner one that you see there in the bottom, where they mix those two. Our visual learners like to see things. They want to see videos, charts, pictures, diagrams. A lot of them like to pull up x-rays and look at them and kind of see how, what muscles are there, kind of visualize what's going on. So if you have those available or if you have videos that you use for techniques or exercises, go ahead and share those with them. My kinesthetic learners are my hands-on. They're one that they could just look at it and they can watch you and then they can replicate it. So they might like that, see it done by you and then perform it right after it on the same patient and see if they're getting the same feedback, see how their hand placement is, or picking parameters on modalities. So they like to do and be involved with things. Auditory learners. Now, sometimes you don't find auditory learners too much in the PT field, but I have about 3 to 4 students that are auditory learners, which means they may look like they are not listening or paying attention or not following, but they are listening, they're absorbing everything that you say. I am not an auditory learner, so sometimes that's hard for me to kind of picture because I'm so visual and hands-on and I need to see it and kind of do it, or they can learn just by listening. And so it does fascinate me, but know that there is kind of a difference for auditory learners. Bottom line, you're a mentor. And you're going to help train, you're going to set up goals for them, you're coaching them, motivating them, giving them advice. This is all setting them up for success, and honestly, we couldn't do this without you. So I really appreciate you stepping up and being a mentor to our students. We had great comments from our CIs last year from our last year's class. And I really do look forward to our clinical rotations for 2018 and 2019. Here are some resources that you can have. I will send links to these. You have Student Clinical Handbook, Clinical Education Handbook. We do have the ESP training video. And if you have any other questions, please go ahead and give me a call in my office, or you can send me an email as well, and then I will get in contact with you. So lastly, thank you very much. Again, we could not do this without you, so we really do appreciate the time and effort and the knowledge and skills that you pass on towards these students. Go ahead and give us a call if you need anything. We will be happy to assist. Have a great day.